Welcome to On the Edge. I'm Darren Slyman. Today we are thrilled to welcome Dr. Allison Bloom to the program. Dr. Bloom is a specialist in reproductive endocrinology and infertility at Mainline Fertility, where she leads their third-party egg donor programs, and as a LGBTQ plus ambassador for the Prelude Network, she brings a unique blend of expertise and advocacy with a personal journey through her infertility that inspires her work. With experience in IVF, egg freezing, and LGBTQ plus family building, she's a true leader in the field, empowering her patients with knowledge and support. Please welcome to the program, Dr. Bloom. Hello.
Hi, good morning. Thank you for having me.
Very excited to have you here. Now, Dr. Bloom, can you share with me what inspired you to specialize in reproductive endocrinology and infertility, and how has your personal journey shaped your approach to patient care?
Yeah, absolutely. It's kind of a fun story. So I was a general OBGYN for 5 years. So I delivered lots of babies. I did regular GYN care, adolescent care, and obstetrics at a major hospital in Pennsylvania, the first hospital in the country, Pennsylvania Hospital. And throughout that journey, I loved what I did, but I also really loved the office aspect of my work and being able to talk and communicate and build relationships with our patients. And through that, there was a couple things that always stuck out to me. The first thing was patients that struggled getting pregnant. And I wanted to be able to do more. The second was recurrent pregnancy loss, and just really not feeling like I can do enough to help these people build their family. And the thing that sort of sealed the deal was really feeling that I could have a special place in this field to build LGBTQ plus families. As I was sort of making that decision to transition and do a fellowship in infertility, my wife and I were starting to try to build a family. And like many gay couples, they think, oh, I just need sperm, or I just need an egg, or I just need a surrogate. And that journey really wasn't that easy for us. So we were a little over a year and a half before we actually successfully achieved pregnancy. We went through all the testing. We went through multiple IUI cycles, intrauterine insemination with donor sperm. And we ended up eventually needing IVF, not really knowing that that's what we would need. We went through an IVF cycle. My wife did very well, and we made a bunch of embryos, but the first transfer didn't work. And then the second transfer did work, and because we had such a long journey and the age that we started, we did put 2 embryos back, and we have beautiful 7-year-old twin boys.
Aww.
So that journey going through myself kind of sealed the deal as, you know what, this is what I want to do. And I learned so much on that journey myself that even as an OBGYN, and you think I should know so much more than the general community that's starting to build a family, I knew so little in comparison to what you learn when you specialize in reproductive endocrinology and infertility. And it still blows my mind every day. And I talk about this even with my nurse practitioner, like how people don't understand the reproductive system. And I said to her just this week, you know what, even as an OBGYN, I didn't understand the reproductive system like I do today and the intricacies of it and how hard it actually is to get pregnant. And it's amazing that so many people can without struggles. So that's really what drove my desire to stop what I was doing, what I loved. I ended up doing a 3-year fellowship in reproductive endocrinology, so now I'm a student again, and then finally kind of achieved this goal to really do what I love, and I'm so happy with the decision. It definitely has met all my hopes and desires.
Oh, it's so beautiful. I love that journey.
Yeah.
And do you find that, like, since you said you're back to school now, I'm sure you went, a little bit previously, how much has that changed in education?
In terms of
well, like, you when you first went to school and you did
Yeah.
all you did all your studies and you decided to be an OGBYN and all that stuff, but now you're back. I know that, like, even myself, like, if I go back to school now, which I've taken some classes for some people
Sure.
specifically in social media, I'm like, I don't know these terms anymore.
Yeah.
I'm too old.
Yeah. It's a little different than like school where you're in a classroom. So
Okay.
medical school is 4 years, and then you do a residency. An OBGYN residency is 4 years, and that's less classroom and more practical. So you're really in the hospitals working with patients. You do some didactic kind of learning behind the scenes and some research and courses, but not like going to class every day. And the same thing is true for a fellowship. So you're really working directly with people in that field, and seeing patients through that journey, and kind of even building your own practice. And, as a fellow, I made relationships with patients that then once I was no longer a fellow and I was an attending at the practice, they actually they transitioned to me as my patients, because we had built such a great rapport as a fellow, or they've come back for second or third pregnancies and chosen to come back to me, which was really exciting.
Awesome. Well, I learned that you also lead the third-party and egg donor programs at Mainline Fertility. What are some of the key challenges and rewards of directing this particular program and helping people of diverse backgrounds?
Yeah. So our third party team is something I'm really proud of. And I think over the last couple of years, when I joined this practice, this was my goal. And everybody at Mainline Fertility and Inception has been behind me 100% to build this type of practice to provide the care we do to such a diverse population. I think the biggest challenges are finding donors. So we have a big recruitment process behind the scenes. We're really picky about donors. So when we're looking for an egg donor, there's very specific criteria we want, but we also need to make sure that we're getting diversity in our egg donors, because everybody needs and wants something different. There's a lot of stuff that happens behind the scenes before anybody has even presented a donor, and these donors are well screened. I think the other hard thing is that when people know that they need donor eggs, and it's a different experience for, say, two dads, right? Two dads go in, I want to have a baby. They know I need a donor egg, right? You don't have eggs, so there's no choice. So that is a little bit different. They're giving a lot of that, the control to somebody else. And I always tell my intended parents, these are donors and people and not robots. And I know that sounds weird, but there's no way I can sit and guarantee an outcome. And everybody can have a different cycle or a different outcome. And different sperm sources, when you fertilize eggs, even the same set of eggs with two different sperm sources, one guy may do very well and the other guy might not. And this is because everybody's physiology and reproductive potential is different. So the challenges in terms of the same-sex male couple donor egg programs is you want everything to be perfect because it's expensive. They're really desiring this and you just want it to go smoothly, and sometimes there's bumps in the road. And I know this is corny, but I always say it, they call it a journey for a reason. And there is going to be setbacks and things that go really well, and as long as we get you to that healthy take-home baby, you just have to be patient along the way. The other piece of third-party reproduction is that a lot of people need third-party reproduction for reasons that they didn't expect, right? Heterosexual couples that are not able to make a child and carry a pregnancy, and that's a much harder journey for them in different emotional ways than coming in as going, I know I need an egg donor. I know I need a surrogate. So I think my team does a really nice job not only dealing with making sure patients are prepared, making the right choices, but also providing the support they need in any way that they need it. And it's different for every patient or couple, but realizing that people need egg donors and surrogates or sperm donors for a variety of reasons. And sometimes they're known reasons, and sometimes this is not where I hope to end up, but I'm here. And, our team is here to help them as well.
I had a really close friend of mine, a gay male couple, and actually a female lesbian couple. And they actually got together and they decided to work together as a unit. Mm-hmm. And they ended up having two children, both, carried by the lesbians, donated by the males. And they had two children. One went to the males, one went to the females,
Wow.
which I thought was such a brilliant idea.
Yeah. Yep.
And who knew that that would all work out for them? But I'm very proud of them. I know that you're a global ambassador for the LGBTQ community with the Prelude Network. Can you tell me a little bit about Prelude Network?
Sure. So Prelude is kind of our big umbrella organization that makes up all the clinics that are associated with Inception. So Mainline Fertility and all the other clinics around the country and Canada are part of the Prelude Network. So the nice thing about the network is that as physicians, we all come together and we have a lot of groups or advisory boards on different topics so that we're providing the best care across the network, and we're using each other to figure out what is the best for patients. So for example, I sit on the advisory board for the gestational surrogates and third-party reproduction. So, I'm someone that may have more expertise and more comfort and more passion about this than a doctor in Florida, but it doesn't mean they don't want to provide the same level of care, and we come together to help each other do the best in every piece of reproductive medicine. So it's a really excited part of being a part of the network. You feel like you have a support system outside just your local clinic.
What do you think are some of the unique challenges that the any LGBTQ individual or couple face when they're trying to go into this next chapter of their life?
Yeah. I think the first big challenge is choosing a donor. I think that's very hard for some people and harder for some than others. Really, we have to think about whether we're talking about donor sperm or donor egg. We have to think about, what is important to you as a couple. Is it important that you and your child know this person? Is it important that you and your child have the ability to know this person if they want to? Or do you feel like we don't want to know and that makes us uncomfortable? And that can come with some challenges down the road to a child and a family. We do require that all our patients using donor egg, donor sperm, or gestational carriers, and not just our gay community, do have an appointment with someone who specializes in third-party reproduction, which is usually a psychologist that specializes this. And this is not an evaluation of are you going to be a good parent. This is an educational session about what things may come up in this child's life and your life, and what support systems are there, and what things to consider as a couple when you are choosing a donor. So I think the donor piece is a big one. I think the second one is insurance coverage. And we're doing much better at this. So ASRM, the American Society of Reproductive Medicine, has now put in the definition of infertility the need for donor gametes or a carrier, which means by definition, as two dads or two women, you have infertility by American Society of Reproductive Medicine, which is a huge thing, forcing insurance companies to respect that as a definition of infertility. So we are seeing a huge change in coverage where we used to see two women come in and they would not have any coverage unless they were trying for a year. You're like, well, what does that mean? I have to do 12 inseminations before I say you need IVF? That just doesn't seem fair. Doing a lot better with insurance companies now. We're really seeing that number come down and have much better, more inclusive coverage. So I congratulate the insurance companies there. And I would say as a user of that insurance, if you don't have that coverage and if you see that barrier in your care, you go to your HR department and you go to that insurance company and you explain the situation, because this is actually a discriminatory type of a policy. And we're seeing that a lot of insurance companies will actually provide that coverage when people go back directly to them. Not always, much more than even a couple years ago.
Well, that's what I was thinking, sitting here listening to that. I thought, I think it was around 2015, 2016, that in the U.S. we garnered marriage equality. And I, at that time, noticed a huge spike in gay couples, male, female, doesn't matter, and really wanted to try to build families. So this is kind of a new segment of population that we really haven't had for centuries and centuries and centuries, right?
Yep.
So, and not to get too political, but as we approach this next election cycle, what are some things that LGBTQ plus individuals and couples can do to kind of protect themselves through this process and as we go through this political kind of back and forth that we're dealing with right now?
Yeah. I don't know specifically if there's things that we can do to protect these insurance coverage benefits or these rights directly, except be an advocate and be out in the community and make sure you vote and make sure you're heard. The one thing I will say is the protections after a child's born. Really knowing the legal rights in your state, because that varies. And I'm not a lawyer, so I'm not going to speak to exactly what is necessary. But for example, in Pennsylvania, let's say a same-sex female couple or trans non-binary couple have a child. The person who carried the pregnancy is the parent, and actually the other parent needs to adopt the child, even if they're legally married. So just knowing where you live and making sure that you have the appropriate rights to protect your family and your children after. In the surrogacy journey with intended dads, that is really built in very nicely because you have to work with two lawyers. Surrogate has one, and you as a couple have one, and those rights and those legal stuff are built into your journey and very well established. But where it gets missed is on the donor sperm side, because patients think, I'm on the birth certificate, right? So in Pennsylvania, if you're born, if you're there and you say you're the parent, you're on the birth certificate, but you do not have legal rights. You are actually not legal parent. And that's going to vary from state to state, but that's something that now our legal representatives in this area, at least, are pushing to make sure that those rights are true for gay couples as well, where if you are married and having a child, you automatically get those rights. But that is something that is being fought for right now.
We are currently in kind of a tumultuous election cycle time. What are some things that LGBTQ plus individuals and couples can do to kind of protect themselves through this kind of rocky time period that we're going through?
Yeah, that's a good question. I think the first thing is really legal rights. So, if as a couple, being legally married as a protection, and then when you're bringing a child into the world, especially in our same-sex female couples, trans or non-binary patients, using donor sperm, we often see this missed, where patients are delivering babies and they assume that they're married, and even in the state of Pennsylvania, you may be on the birth certificate because you identify yourself as the second parent, but legally you do not have rights to that child. And you do need to obtain a third-party lawyer, a reproduction lawyer, and there's people that specialize this and actually do a second parent or a step-parent adoption of your child in order to protect your child and your family. We see that in the male intended parents using donors and surrogates. These legal protections are really built into the process because most people need a lawyer to have that relationship or that contract with the surrogate. So those parent adoptions, either pre-birth or post-birth, are coming into play by that legal team beforehand. But I think it's often missed on the donor sperm side. So just a reminder to protect yourself. And then I think the last thing, like I said before, is talk to your HR departments, advocate for yourself, make sure you have the same family building rights built into your insurance that the rest of the employers have. And I think more and more we're seeing companies do a really nice job with that.
It was around 2015, 2016 that we got marriage equality, and there was just this boom of, couples really wanting to actually finally legally be able to have a family. How have you seen that kind of spike and that area grow in our world?
Yeah, I think that LGBTQ couples are probably wanting children at a similar rate as our heterosexual couples, and also single parents. So people are not necessarily couples. I see a lot of gay dads or single gay women start families on their own. So you don't have to be in a partnership. You just have to want to build a family. So I think it is more common. I think it is very well accepted. Like, any LGBTQ plus patient who walks into my office is treated exactly the same way as everybody else. We really pride ourselves in taking care of this community. I always wonder the exact number, but I'd say about 25% at least of my patient population is LGBTQ plus identified. And I always say, I love my straight couples too, and my single female, single men. This is not all I do, but I love it to do it. And it is a nice piece of my practice that I'm proud of.
That's amazing. Dr. Bloom, thank you. Thank you so much
You're
for
welcome.
giving us some information, and let's get it out to the nation, and let's continue our fight to be able to build beautiful families together. For everyone out there, please be sure and check out Dr. Bloom's website at mainlinefertility.com. Follow her on all of the social medias, which again is Mainline Fertility at Instagram, Facebook, all those types of things. Dr. Bloom, again, I really appreciate you taking some time today to chat with us at Edge. And I will touch base and find out more things coming up in the new year.
Absolutely. Thank you so much for having me. This was fun.
Have a great day. And for you, my audience, please be sure and check out Edge Media Network on all our social media platforms. And for daily queer content, check out our website at edgemedianetwork.com. Thanks so much.